I'm Grace Woods, and I'm joined with my two co-hosts, Erin O'Sullivan and Hala Wilson, on our Law podcast today. On today's episode, we'll be talking about the Office for Human Research Protections. This is a congressional act that was introduced by Donna Shalala on June 13, 2000. Shalala was the United States Secretary of Health and Human Services under Bill Clinton during the years from 1993 to 2001. As her time as a politician, one of her main goals was improving America's health. Americans' health is extremely important, but kind of pushed to the side at some points within the government. A quote from her is, "I'm interested in getting people to use healthcare systems at the right time, getting them to see the doctor early enough before small health problems turn serious. A lot of things go undetected in the United States healthcare system and causes a lot of deaths that don't need to be happen if people are treated correctly, and this is one of the main goals that she wanted to reach." She also was an extremely influential person because she was the first Lebanese American to serve the cabinet position. She then became the president of the University of Miami from 2001 to 2015, and then became the head of the Clinton Foundation soon after that. She worked very closely with the Clintons and worked very well with them. One of the main questions is why the Office for Human Research Protections was founded was because to oversee biomedical and behavioral research done on human test subjects by the United States Health Department and Human Services. I've learned in my AP Psych class that certain research that is done is completely unjust, and Shalala wanted to get rid of this in order to benefit the people of the United States that may be getting taken advantage of by people. Also, when people get tests, like when people are allowed to get tests done and get paid for them, they don't know the consequences of it, and this act makes sure that research is done ethically and that humans are not harmed or taken advantage of during the testing process, because the United States is filled with poverty, some people might see money and want to do whatever they need to in order to get it. So she created this in order so these people never get taken advantage of. And now I'm passing it on to my co-host, Erin, to continue on this subject matter.
So, one of the most asked questions that we've been getting on this podcast are what is so notable about the Office for Human Research Protections? And basically, they just protect against the mistreatment of human test subjects in the United States, and they basically just make sure that everything is being done ethically and safely in a way that will not hurt any human test subjects. And you guys may be wondering how the Office for Human Research Protections can even do this. And well, firstly, they make sure that the federal set of regulations is being followed during all human research, and this can include things like informed consent, where participants must understand all research-related information before even actually agreeing to take part in a specific test. And they also work to educate the public on human welfare throughout their research and all of the research that they've done. And this can range from in-person workshops to online videos and even lectures by human research professionals. And the Office for Human Research Protections develops educational materials and programs, and they provide advice within their research. Human test subjects are extremely important, we need human test subjects anyway, and they're extremely important because they offer so many advances in human health and human welfare. And even though not all research and tests on humans have been done safely, the Office for Human Research Protections is set in place in order to ensure humans' rights and safety. And that is why I think it's so notable, because they have to make sure that everything is done ethically and in a safe way that will not harm any humans taking place in a test.
And now Erin will be passing it off to Hala.
Predict what role your organization or public body will have in the future as the COVID-19 pandemic continues around the world. As we continue to see COVID cases appear around the world, scientists have been working tirelessly to create a safe vaccine to give to the public. The vaccine is incredibly important as it will create herd immunity and stop the spread of COVID-19. However, the vaccines had to be tested on people. The Office of Human Research Protections would ensure that any research done on human beings was done ethically, and that the rights of test subjects were protected. Furthermore, there may be a new strain of virus that develops, requiring a new vaccine. The Office of Human Research Protections will ensure that when the new vaccine is tested on humans, their rights are protected as well. Other new items may also need to be tested, such as new masks or hand sanitizers, and they will also benefit from this organization. In terms of drugs, the Food and Drug Administration has approved one drug, remdesivir, to treat COVID-19. However, in the future, we may see the development of other drugs that treat COVID-19 and are more effective. The Office of Human Research Protections will make sure that the drug trials are carried out ethically. The organization will make sure that not only medical professionals are following clinical drug testing guidelines, but that the public is educated as well. Through their workshops and online videos, people participating in the studies will know how they should be treated and what rights they have during testing.
And now to close off the episode with Erin.
Thank you so much for tuning in to another episode of Law 101, hosted by your favorite students, Hala Wilson, Grace Woods, and Erin O'Sullivan. You can join us next week for another interesting episode all about the latest law updates.